Hello, my name is Kylie Trahan, and this is a public service announcement over CMV. CMV is a beta herpes virus that causes lifelong infection in humans. The virus generally remains unnoticed since it lays dormant in the human body. However, it can be severely pathogenic to immunocompromised patients. CMV is typically spread through body fluids such as saliva, semen, blood, urine, vaginal fluids, and breast milk. You can contract CMV by touching your eyes, nose, or mouth after coming into contact with the body fluids of someone with CMV. Through sexual contact with an infected person, or during birth. An infected mother can pass the virus to her baby before or during birth. The risk of virus transmission to your baby is higher if it's the first time you have had the infection, rather than a reactivated infection. However, most people are infected during childhood at places like daycares, nurseries, school, or other places where children come in close contact with other children or people infected with CMV. Most people that are infected with CMV show no symptoms. A few infected people may feel ill and have a fever. CMV in young adults and adolescents may cause an illness with symptoms of fever and fatigue. People at a greater risk of signs and symptoms of CMV include newborns infected with CMV at birth, infants who become infected during birth, or people with weakened immune systems. Babies with congenital CMV who are sick at birth tend to have more significant symptoms, including premature birth, low birth weight, enlarged and poorly functioning liver, purple skin splotches, enlarged spleen, seizures, jaundice, which is the yellowing of the skin and eyes, or microcephaly, which is an abnormally small head. In people with a weakened immune system, such as HIV or AIDS, CMV infections is a common viral complication. The virus tends to infect the retina of the eye and can cause blindness. It can infect the brain, cause pneumonia, or patients can develop painful ulcers in their intestines or esophagus. To diagnose CMV, doctors must perform a lab test. They can test the blood, a tissue sample, or other body fluids such as saliva or urine. If you are pregnant, testing to determine whether you've ever been infected with CMV can be very important. If you test positive for CMV while pregnant, your doctor will obtain and examine a sample of amniotic fluid through amniocentesis to determine if the fetus has been infected as well. There is no cure for CMV, and treatment for CMV infections is not necessary in healthy children and adults, considering they generally recover without medication. However, newborns and people with compromised immune systems need treatment when they're having signs and symptoms of CMV infection. The most common treatment for CMV is antiviral medication. They can slow the reproduction of the virus, but cannot eliminate it. Here are the 4 most common medications. Since CMV is a common virus, it is not always possible to prevent infection. However, there are preventative steps to reduce the risk of CMV infection. Washing hands frequently for 15 to 20 seconds, especially when in contact with young children, changing diapers, and handling toys, or when exposed to oral secretions. Always avoid sharing food, drinks, and eating utensils with others. Avoid contact with saliva when kissing a child. Always remember to clean toys, countertops, and surfaces that come into contact with the child's urine or saliva. And always use condoms during sexual contact. CMV affects people all over the world and of all ages. Experts estimate that nearly 50% of the population of the United States has been infected with CMV, and 80% of adults have been infected by the time they are 40 years old. The average age of infection is 28.6 years old. In the United States, 2 out of 100 people per year will be infected with CMV, and these people are likely to pass to at least 2 more people. Approximately 27,000 new CMV infections occur among pregnant women in the United States each year, and 1 out of 3 of the pregnant women who become infected with CMV will pass the virus on to their unborn child. Thank you for listening to my PSA over CMV.